Good afternoon, good morning, good evening, everyone. I think our colleagues are coming in. Thank you so much for joining. We can probably wait for a minute more before more colleagues would come. All right, I think we can start now. Many of our colleagues are already joining, and I'm sure more would come. Good afternoon, good morning, good evening to everyone. We welcome you all, particularly those of you joining from far away or at late or early times. Thank you for joining this WHO EPIWIN MPOX series, IPC for health workers in the context of MPOX. This is the fourth in a series of EPIWIN webinars on the MPOX, public health emergency of international concern. For those new to EPIWIN, this is the WHO Information Network for Epidemics for Science and Knowledge Translation in Health Emergencies. Our goal is to translate science in accessible, understandable, and relevant ways for evidence-informed actions and decisions in health emergency preparedness and response. Today, we have a great panel to discuss IPC for health workers in the context of MPOX. First, we will hear from Dr. Michelle Yao, who is the Director of Strategic Health Operations in WHO HQ. He will give us the welcome and opening remarks, and then we will listen to Dr. Victoria Willett, WHO Health Emergencies, Country Readiness and Strengthening, also from WHO HQ. We will hear from Dr. Andy Bulabula, who is the Technical Officer for Infection Prevention and Control Division in Africa CDC. Dr. Andy is a medical director with specialist training in infection prevention and control, and he is a clinical epidemiologist with a PhD in public health. He also has extensive experience in developing IPC training materials, guidelines, and programs, and currently serves as a senior technical officer at the Africa CDC and Prevention, Africa CDC. And finally, but not the least, we have Dr. Gertrude Nsambi, the director of the Ministry of Public Health, Hygiene, and Prevention from the Democratic Republic of Congo. And she will be introduced later by Dr. Toro. So my name is Lester, and I will be moderating today's webinar. Before we proceed, here are some housekeeping and reminders. This webinar is being live streamed on the EPIWIN YouTube channel. The webinar is being recorded, and afterwards, the recording will be available from our website. The address will appear in the chat. We invite you all to post your name, location, and organization in the chat box. We would love to hear where you're joining us from. We will have interpreters for both English and French. Just click the interpretation tab in your Zoom screen. And finally, please add any questions you may have to the Q&A box, not in the chat, so we could track them better. And without further ado, I will hand over the floor to Dr. Michelle Yao for the welcome to this EPIWIN webinar. Michelle?
Thank you very much. The EPIWIN is one of my favorite sections. So I'm very happy and proud to make the opening remark today. Welcome to all the colleagues and the experts connected around the world. So the first point is that infection prevention and control is critical to manage any major outbreak. In the past, we noticed that we had many challenges related to nosocomial transmission. And in most of the, at least poor or fragile health system, we experience health workers being contaminated because of also weaknesses related to infection prevention and control. This outbreak, Mpox outbreak, is also particular, this fake, because we have two clades. The clade 1B with a sustained human to human transmission, but that bring also a severe cases that have to be managed by health workers. And the clade 1B also is spreading across different countries. And then we have the clade 1A, where it was initially endemic in DRC, but also spreading across different provinces into DRC. So this brings the health system as well as the health services at a huge stress. And this highlights the issue of disrupting other services if a proper infection prevention and control intervention is not performed, meaning ensuring that we have an appropriate triage that allows other services to run concomitantly when dealing with the Mpox outbreak. So we are very happy and proud to see that there is an interim guidance that will help health workers to understand more what needs to be done, that will guide them on critical interventions that need to be performed within health facilities. And by the way, there is also a component that is needed, mainly addressing cases within communities. And also this guidance will help also to deal with how we manage dead bodies in terms of infection and prevention control wise. So this session is quite critical and one of the main pillar in responding to this outbreak. So I wish you all a fruitful deliberation during this session. Thank you very much.
Thank you very much, Dr. Yao, and thank you also for announcing and reminding us of the interim guidance for health workers and also for community IPC that is also coming. And thanks for the quick background on the public health emergency. As in the previous webinars, we want to know more a bit about you, the audience. So to do that, we have a short Slido survey, and I turn over to Sophia for this. Sophia? Sophia, you're on mute. All right, so yeah, you can see on the screen the slido.com number, and our colleagues, many of you are already giving the answers in terms of your current involvement in the response to Mpox. All right, we seem to have lost the Slido. We seem to have lost the Slido screen. Let me put it back.
You're
All right.
muted, Sophia. We can't hear
You're
you.
muted. We can't hear you, Sophia, and the screen is also not here. All right. Yeah, we can see the screen again for Slido.
Hi, are you able to hear me?
Yes, now, yes.
Apologies for that. So it looks like more than 60% of our audience are health workers and working on MPOX. A little less than 30% are health workers, but not working on MPOX. So it's great to see that for a majority of you, this would be very relevant, and hope you find the rest of the webinar very helpful. Thank you, and back to you, Lester.
Thank you very much, Sophia. It's great to see the picture of the current work among our colleagues, the variety of where they're working on MPOX. So now, without further ado, let me give the floor to Vicky Willett for the overview of WHO IPC and WASH guideline and tools for MPOX. Vicky, I turn over to you.
Thank you so much, Lester. Just waiting for the slides. Meanwhile, I'll introduce myself, Vicky Willett. I work as an IPC consultant with the WHO Health Emergencies Program, our IPC and WASH team, and I've been with the team pretty much since 2020, started with COVID, and now supporting the MPOX response. So today we're going to talk about keeping individuals with MPOX and health and care workers that care for them safe. We could go to the next slide, please. So the objectives of today's webinar are to emphasize the WHO infection prevention control recommendations and water and sanitation and hygiene recommendations, and the tools that have been developed for healthcare settings that care for patients with suspected or confirmed MPOX, to just let you know what tools are available that may support you in your work. And then secondly, to share some practical experiences implementing IPC measures, strengthening WASH services in health facilities during the MPOX response. And hopefully I'm not speaking too fast for our interpreters, so I could just check. And we'll go to the next slide, please. So at WHO, the IPC and WASH strategy for MPOX has been developed, and we sit within two sort of clusters at WHO. We sit in safe and scalable care, and within that pillar, we are aiming to strengthen IPC and WASH in health facilities and also in the MPOX treatment centers that are being set up in a number of countries that are seeing rising numbers of cases. In the enhanced community protection pillar, we are also supporting that pillar by strengthening IPC and WASH for home care and isolation. A number of mild and uncomplicated cases of MPOX are being sent home to be cared for there. And we will have a follow-up webinar on October 29th to talk about the IPC recommendations for home care and isolation. And then the second area we are focusing our efforts on is to strengthen IPC and WASH in congregate settings. Congregate settings could be schools, it could be prisons, it could be IDP and refugee camps, and to make sure that the IPC and WASH measures there are being implemented, providing advice and technical support on the types of measures to prevent transmission in those settings. So next slide, please. We already have a guideline that was published a couple of years ago for clinical management and infection prevention control for monkeypox. And within that document, there are several infection prevention and control recommendations. We have recommendations for conducting screening and triage to rapidly identify cases and isolate them and send them on for additional assessment through triage and determining whether they need to be admitted or sent home, what the best clinical course is. We have 7 recommendations for healthcare settings that focus on elements in healthcare facilities, such as PPE use, environmental cleaning and disinfection, managing linen and laundry, managing waste. There are 4 recommendations in the guideline for home and community settings. And here we talk about the IPC elements that need to be considered in order to send patients home to be cared for at home, such as having space to isolate, the types of measures that caregivers should take, and including WASH and waste management for any items that may be used when caring or supporting that person at home with MPOX. We do have a health and care worker exposure, so recommendations, so what to do if a health and care worker does receive an exposure to some sort of blood or body fluids or skin of the person with MPOX, and a recommendation on managing the deceased who have MPOX. So next slide, please. So I mentioned we have recommendations on screening, and to support that recommendation, we have developed a screening tool for healthcare facilities to use at all of their entrances. And there's a picture of it here, and it will be published on our website. This allows for prompt identification of patients with possible MPOX and implementation of IPC measures such as the use of isolation, the use of PPE to reduce transmission in healthcare facilities. So we really want to emphasize the importance of screening at the first point of contact with the health facility, the placement of patients in isolation where that's possible, and of course, in infection control, we always emphasize hand hygiene, the appropriate selection and use of PPE, remembering that more isn't always better. We want to make sure we use the right PPE at the right moment, and maintaining physical distance if possible during the screening process. And provided the physical distance can be maintained, then PPE is not needed by the screeners. So this form is going to be posted on our website soon. I believe it is in circulation in some countries that are dealing with cases already, and it can be adapted to countries' needs. Next slide, please. We've also created some posters for steps to put on and remove personal protective equipment for MPOX, following contact and droplet precautions, with currently the addition of a filtering face piece respirator when caring for any suspect MPOX patient, or if any airborne precautions are in use. And of course, always emphasizing hand hygiene should be done according to the WHO 5 moments. And of course, before putting on PPE and after removing PPE. And these posters are currently available on our website. Next slide, please. Oh, I think we've got the same. You can go to the next, please. So just briefly highlighting, we are recommending the use of contact and droplet precautions with the addition of a respirator, as I mentioned, in the event that it could be chickenpox or something else until that is sorted out. And just in general, we do recommend at the moment a respirator for use when caring for patients with MPOX. And of course, airborne precautions should be added in the event that some sort of aerosol generating procedure is used for the person with MPOX. And again, emphasizing hand hygiene. So we'll go on to the next slide. And our colleagues from Africa CDC are going to go into more detail on the recommendations for health and care workers to follow when caring for patients with MPOX. So I'm just giving you some highlights here. And this is I see we have a typo, MPOX rapid assessment tool for health facilities. This is being distributed to numerous countries, and it will be available on our website soon as well. And this is a tool that people working in infection control or supporting infection prevention control and WASH activities in health facilities can use to assess their ability to safely provide care. It looks at a number of different criteria. This is quite tiny, so if you could please click again, please. Hopefully my animations work. There are a number of elements of criteria, and within each criteria, there are things to assess whether you meet those or not. For example, do you have a screening station at the entry points? Do you have a questionnaire or some sort of screening form? Do you have non-contact thermometers, hand hygiene stations, etc.? So facilities can use this to guide and make sure that they have the elements for IPC and WASH in place to safely provide care. And if you could click again, please. At the end of the assessment, there is a score that's provided for the facility. And along with that comes the option to provide and implement an improvement plan. So based on the gaps identified through the assessment process, an improvement plan can be developed, and you can work towards improving your score and making sure everything is in place to safely provide care. And again, these are already being circulated in some countries, and we're hoping to move forward with getting them on the website soon. It is really important that patient care activities take place in a clean and hygienic environment that facilitates the practices for infection prevention control and prevention of healthcare-associated infections. And of course, the important and critical element of that is to ensure that we have basic water, sanitation, and hygiene infrastructure and services available in all health facilities. And if you're struggling with that, there is a WashFit tool that is available. It's a practical guide for improving the quality of WashFit in healthcare facilities and improving quality of care. So this tool is available on the WHO website, and it's another implementation guide and assessment tool that health facilities can use to ensure they have what they need in place to continue to make the environment safe for health workers and for the patients coming to your facility. Next slide, please. And here are a number of technical resources that exist if you're looking for support for improving wash and waste in healthcare facilities. So there's online courses for WashFit on our Open WHO channel. And as well, we should highlight there's also a number of infection prevention control courses on the Open WHO channel, focusing on standard precautions and transmission-based precautions. So those are available for you if you need to understand a little bit more about the IPC or WashFit. There's a number of documents that address managing sharps and sharps waste, waste in general in healthcare facilities, and of course the WashFit package. Next slide, please. And we do have new tools coming. So we are currently working on the Health and Care Worker MPOX Exposure Risk Assessment Form, and this is a tool to assist facilities and people working in infection prevention control and occupational health and safety to assess the risk of a person who feels that they may have had an exposure to somebody or the environment with MPOX. So it's a risk assessment with some guidance on how to manage that possible exposure. We're working on infection prevention control measures for vaccination campaigns as vaccinations roll out, and training materials for community health workers in a number of countries. There's a number of community health workers that are involved, and we're collaborating to support development of the training materials for those individuals, and they will be coming soon. So with that, those are some of the highlights from WHO. And I would now like to turn over to our colleague from Africa CDC, Dr. Andy Bulabula, to talk about in more detail about the infection prevention control measures and WASH measures for health workers caring for patients with MPOX. Over to you. And please, everyone, remember to post any questions in the Q&A, and we will try to answer those. Thank you so much.
Yeah, thank you, Vicky. Good afternoon, good morning, good evening, everyone, depending from where you are joining from. So I will be highlighting the IPC measures for healthcare workers. And this is really based on the WHO MPOX guidelines that were published in 2022, around June. Next slide, please. Yeah, this is just the outline. Next slide, please. Yeah, so as you all know, infection prevention and control measures are really very important for the prevention of monkeypox, which is now MPOX, transmission in healthcare settings. And the target audience here include health facility managers, clinicians, and IPC practitioners across various healthcare. And of course, healthcare settings. And of course, this is through primary care clinics, emergency departments, infectious disease clinics, and more. And the goal is really to implement appropriate IPC measures for suspected and confirmed MPOX cases. Sorry for the monkeypox coming over again. Next slide, please. So IPC is really necessary as you deal with suspected and confirmed MPOX patients. And the precautions will really include screening and triage at the first point of contact. It will also involve isolation, the use of personal protective equipment, such as medical masks, gloves, gowns, and eye protection. And of course, as you all know, PPE is based on the risk assessment. So when you're dealing with patients, you still need to run a risk assessment, and the findings of that will decide and guide on the choice of the PPE using. And in this case, that's still really applicable. So for patient isolation in a well-ventilated single room, or you also do cohorting of suspected patients away from confirmed patients. Next slide, please. Yeah, so for recommendation number 1, we have contact and droplet precautions. For the contact and droplet precautions, really, this should be implemented for any suspected patient with Mpox. And of course, when it comes to a kind of co-infection with varicella zoster virus, we need to consider airborne precautions. So differential need to kick in here. So key actions, we really need to use PPE, masks, gloves, gowns, and implement distancing measures to minimize exposure to respiratory droplets. Next slide, please. Yeah, for recommendation number 2, we have enhanced precautions for confirmed Mpox cases. And of course, here we don't only have the standard precautions, but we also include here now additional ones. This is contact and droplet precautions, which must continue. And of course, the use of respirators instead of medical masks, as they have a different level of protection. And of course, the objective is to limit exposure to airborne transmission when treating confirmed Mpox patients. Next slide, please. So for airborne precautions, when it comes to aerosol generating procedures, recommendation number 3 is about implementing the airborne precautions if you have some of these procedures which will generate aerosols being performed. That would include here intubation, extubation as well. Yeah, and some other activities like bronchoscopy, suctioning, that would require you to use N95 respirators, especially, also gowns, gloves, and eye protection, because there is also a risk of splash of the secretions into the eyes. Next slide, please. So recommendation number 4 is really about environmental cleaning and disinfection. So areas within the health facility frequently used by the patient, or where patient care activities occur, as well as patient care equipment, should be cleaned and disinfected in accordance with national or facility guidelines. And of course, here the sequence, as you all know, before you disinfect, you need to ensure you have proper cleaning, and this is a physical removal of the organic matters on the surfaces before you apply disinfectant, and allow contact time to deactivate all these viruses on the surfaces. So the key action here is really routine cleaning and disinfection of eye-touch surfaces and shared equipment. And during the cleaning process, health workers must put on PPE. And of course, this will include heavy-duty gloves, gown, respirator, either N95 or FFP2. Next slide, please. For recommendation number 5, it's really about safe handling of linens and fabrics. And of course, linens, hospital gowns, towels, and other fabric items should be handled and collected carefully to prevent dispersion of infectious particles, especially when you're removing the linens. Don't shake them so you don't actually increase the number of suspended particles in the air and increase the risk of transmission because of the infectious particles being dispersed. So key actions here use hot water greater than 60 degrees Celsius for laundering, or chlorine for disinfection if hot water is unavailable. And of course, I've mentioned this to avoid shaking the linens. Next slide, please. Yeah, recommendation number 6 focuses on waste management protocols, and all bodily fluids and solid waste from patients with mpox should be treated as infectious waste. And of course, the key actions include here proper disposal of PPE, contaminated medical supplies, waste according to facility protocols to avoid environmental contamination. So it is very important to underline the fact that we need to stick onto the protocols so we don't contaminate ourselves or we don't spread the virus into the environment further. Next slide, please. So recommendation number 7, it's about patient interaction and well-being. So patients isolated with mpox should have measures in place to support interaction with family and visitors. This is really promoting the well-being. And key actions here is to allow controlled visitations or virtual visits with visitors using appropriate PPE. So remember, IPC is not only about healthcare workers and the patient, but also visitors and the community at large. Next slide, please. So in conclusions, what are the key takeaways? So infection prevention and control measures are critical. They are paramount in health facilities to prevent the spread of mpox. And key points here really is the strict adherence to contacts, droplets, and airborne precautions, regular cleaning, waste management, really proper waste management, and patient-centered care is absolutely essential to actually achieve the prevention of mpox transmission within healthcare facilities to protect our healthcare workers, and of course, not spreading more into the admitted patient population at the healthcare facility. Next slide, please. Thank you so much.
Thank you so much. So that is Dr. Andy Bulabula from Africa CDC. And thank you for running us through the different recommendations for IPC for healthcare workers. And now let us hear country experience from DRC. Dr. Gertrude Nsambi will be speaking to us, but she will be introduced by Dr. Soro Lasita from WHO in Afro. Dr. Soro.
Merci beaucoup et bonjour, Lesta. Je vais introduire le docteur Getchou. Alors, docteur Getchou est actuellement la directrice de l'hygiène et la salubrité publique de la RDC. Mais avant... vous m'entendez ou...
All right, I think they were speaking. You may proceed, Dr. Soro, very quickly, and then we can turn over to Dr. Gertrude. Thank you.
Oh, OK. Donc, avant d'arriver là-bas, elle était responsable, la directrice de l'hygiène dans l'Équateur du pays, en RDC.
I think we can...
Voilà. Et actuellement...
je suis là.
D'accord. Donc, on était en train de faire votre introduction, Dr. Getchou. Donc, elle a une expérience de plus de 15 ans dans le domaine de l'eau et assainissement. Donc, elle va nous partager l'expérience de la RDC dans les établissements de santé en réponse à la maladie de mpox. Donc, à vous.
Dr. Gertrude, you may come now. You're still on mute. Dr. Gertrude, you're still on mute. Can you join us?
Docteur Gertrude, on vous attend, hein? On ne vous entend pas.
All right, they might be having some challenges online in connections. So maybe we could proceed to some question and answers, if that's all right. Vicky, while we're waiting for Dr. Gertrude to come in.
Sure. We can go ahead and do that.
Yeah.
Can I, how do you want to do this, Lester?
So there are a few questions while we're waiting for Dr. Gertrude, and maybe we can check out if there are some that we can answer.
Sure. Actually, there's one I want to answer, if that's okay.
Yeah, that's fine.
There's a question in the chat or in the Q&A from William Kim about if Africa CDC is adopting the new definition of airborne transmission from WHO, and if yes, where Mpox fits between direct deposition or airborne transmission or inhalation. And so I will turn it over to Dr. Andy, but I just want to note from WHO, at this point in time, we're looking at and about to publish in our surveillance using the new terminology from WHO of direct deposition, where infectious respiratory particles can be dispersed from coughing or talking to somebody who is infected with Mpox and perhaps has lesions in their mouth, and those could land on the environment or on the mucous membranes of the individual they are in close contact with. So that's how we're looking at this. But keeping in mind, I do want to highlight our guideline is currently under review, and we are looking at wrapping up a systematic review on modes of transmission. And so that work is underway, and we hope to move forward with that by the end of the year. But at this point in time, that is where WHO would be putting that terminology. But I will ask Dr. Andy if he wants to add anything to that from Africa CDC's perspective. I think it's an important question. Over to you, Dr. Andy, if you're able.
Yeah, thank you, Vicky, and thank you for the question. Really timely and relevant. I just need to confirm here that WHO and Africa CDC reviewed that definition and co-launched the document. So we are going in the same direction, actually. And it's clear that when you have respiratory particles and you're coughing or speaking or singing, you are also exhaling these particles, and they may be deposited on surfaces. And if you use or you don't have optimal and hygiene practices, of course, you will contaminate your hands and then deposit it on your mucus, your mucosa, be it on the eye or in your nose. So that's one ways of getting one of the ways of getting contaminated. So I think we're going in the same direction because the two organizations worked together and co-launched this document. Over.
Thank you very much, Vicky and Dr. Andy, for the question and answer. Let me check if Dr. Gertrude is already with us for the third presentation. Dr. Gertrude? It seems that they still have a problem. Can she join us?
She's lost something. I think she's lost something.
Dr. Gertrude, vous êtes là?
lost the sound. So perhaps we can proceed to another question, Vicky, if that's all right. Hopefully, while they are fixing the connection. And the sound.
She just put in the chat. I think she said she's here. She's
Oh,
available.
good.
Okay, good. That's good. That's good.
And I think people are having some challenges with sound.
Docteur Gertrude, si vous êtes là, alors il faut procéder à votre présentation.
Is she back? Checking. She's still on mute. Yes, the sound is back. I hope she can join us. Maybe Vicky, we can have a next question while they're preparing the sound. Vicky, is it possible to answer maybe one more question?
Sure. I'm seeing a number of questions about cleaning and disinfection of the virus in healthcare facilities. And so we do know that the Mpox virus can last for significant amounts of time on surfaces, up to several weeks. But we have conducted some studies, and we are hoping to have those published imminently. And what we have found is that even though it does last for a long time on surfaces, it can easily be inactivated on fabrics and non-porous surfaces. And so we did several tests looking at various disinfectants that are readily available. And we have found, for example, if you tend to use hypochlorite solutions, a 0.05% solution with a 1-minute contact time will inactivate the Mpox virus on surfaces. So if you have, proper and robust cleaning and disinfection programs in your facility, they should be sufficient for removing the virus from the environmental surfaces. And also for linen and laundry, we have found that, again, if you use hot water, at least 70 degrees Celsius, and soap, and or hot water with a bleach concentration of 0.05 solution, it inactivates the virus on linens and laundries. So just wanted to emphasize that for people online, because I'm seeing a lot of questions in general. And I think I'll just also, if Nosheen is still online, if she wants to add anything about waste management, I think there's some questions perhaps in there, if she wants to add anything from WASH, and then we will turn over and see if Dr. Gertrude is able to join. I'm sure if Nosheen's still on. Okay. So those are some of the main questions. Maybe we'll just check in quick with Dr. Gertrude and see if she's able to join, please.
Dr. Gertrude, are you now with us?
Docteur Gertrude, vous êtes là?
Sorry, Vicky. I was trying to find a question related to waste management. Can you highlight it here?
maybe just make some general comments, Nosheen.
Sure. So for the healthcare facilities, all the waste PPE, used PPEs, bandages from the infected patients should be considered as infectious waste. And also it should be disposed of and treated according to the local laws and regulations. In case if there is no local regulations available, we have WHO guidelines for safe waste management of infectious waste available, which we have shared in the slides, as well as for the shops waste management. And we have also the recommended technologies which can be used even in low resource settings. Back to you, Vicky.
All right. Thank you very much, Nosheen and Vicky. Let us check again if Dr. Gertrude is back with us. Checking with Dr. Gertrude and Dr. Sorrow. Are you back? All right.
Je suis là. Bonjour, je suis là. Pour la RDC.
Ok. Si c'est possible de mettre votre caméra et procéder à la présentation.
Je partage mon écran.
Non, ils vont partager à partir de là. Mettez votre caméra.
It's okay if she can't use her camera, Sorrow, because maybe the bandwidth is an issue.
Yeah.
All right. So we will be proceeding with the presentation from Democratic Republic of Congo. This is Dr. Gertrude. We'll be speaking in French. Dr. Gertrude, can you come in?
Yes, je vous entends, Jérôme.
All right, go ahead.
Ok, merci beaucoup. Nous excusons pour ce petit désordre technique. Nous allons faire un aperçu sur les activités de PCI WASH dans les établissements de soins en République démocratique du Congo. Bien sûr, dans ce contexte des Mpox. Dia. Slide, please. Ok, voici notre plan de présentation. Nous allons faire une introduction sur la situation épidémiologique de Mpox en RDC. Nous allons faire un petit aperçu. Voilà, la situation épidémiologique actuelle. Oh là là, ok. Et donc, un aperçu. Et puis, nous allons donner quelques défis et contraintes et puis la conclusion. Dia. Slide. Ok, voilà la situation épidémiologique à la 40e semaine. Nous avons plus de 1000 cas. Et voilà, et c'est plus le sexe féminin, si vous allez bien voir sur le graphique, qui a été plus contaminé que le sexe masculin, et cela autour des âges de entre 10 et 24 ans. Et là, vous allez voir l'évolution de la courbe de la première à la 40e semaine, où nous avons connu le pic à la 36e semaine. Dia, slide. Slide, please. OK. Là, c'est la répartition géographique des cas. Et les taches rouges vous montrent exactement où il y a plus de cas. Vous allez constater que c'est à l'équateur et au sud du Kivu, où il y a plus de cas qui sont rapportés, suivis de Chopo, de Kasaï, de Sankuru plutôt, et puis suivi d'autres provinces. Voilà la répartition spatiale des cas suspects et des décès de monkeypox dans toute la RDC. Slide. Voilà. Le cumul jusqu'à la 40e semaine jusqu'aujourd'hui nous donne 31 615 cas notifiés, 5 902 cas confirmés et plus de 900 décès, soit un taux de létalité de 3%. Et le taux de testing est de 38% et le taux de positivité est de 49%. Slide. Voilà, nous allons donner un aperçu sur les évaluations des établissements de soins qui ont été faites. Et puis, on précise bien, ce sont les établissements de soins prioritaires qui ont reçu aussi un plan de redressement pour les interventions PCI-WASH. Slide. Voilà. Il faut donner d'abord les critères qui ont permis à ce qu'on ait les établissements de soins prioritaires. Et là, le premier critère, c'était le taux d'utilisation des services élevé. Donc, les structures qui ont reçu plus de cas, c'est ça le premier critère. Le deuxième critère était lié aux structures qui ont rapporté au moins un cas positif et se trouvant aussi dans le ring, soit dans l'environnement de la structure qui a rapporté. Et le troisième critère, ce sont les établissements de soins qui ont reçu une infection associée aux soins, donc des cas avec des infections associées aux soins. Et de l'autre côté, vous allez voir les différentes compositions ou composantes qui nous ont permis d'évaluer. Nous citons, il y a le leadership, il y a la formation, l'hygiène des mains, la capacité de dépistage, la capacité d'isolement, les équipements de protection individuelle, la sécurité des injections, le nettoyage et désinfection de l'environnement, la décontamination des équipements et des dispositifs médicaux, identification et prise en charge des patients, la gestion post-expositionnelle, l'emplacement des patients, l'hygiène et assainissement, l'approvisionnement en eau et le stockage, la gestion des déchets et la gestion des corps des mpox décédés. Voilà les différentes composantes qui nous ont permis d'être évalués lors de notre processus d'évaluation des établissements de santé prioritaires. Slide. Voilà, quelle est la méthodologie que nous avons utilisée? Premièrement, cette évaluation initiale, nous signalons que ça a commencé depuis le 22 août et ça va se poursuivre jusqu'au 22 novembre 2024. Et donc, nous allons vous présenter des résultats partiels de ces évaluations. Et les évaluations continuent encore dans les établissements de soins de santé prioritaires. Le deuxième critère, c'est qu'après cette évaluation, un plan de redressement sera élaboré pour permettre à ce que ces structures soient accompagnées pour que les formations et les briefings des superviseurs soient faites, les briefings des prestataires aussi et la redynamisation des comités et l'installation des triages. Et enfin, il y a eu l'analyse des données sur un dashboard. Et nous avons fait aussi les revues des résultats en comparaison avec les autres. Dia, slide.
Doctor, if you can wrap up the presentation, please. We're running out of time. Thank you. Next slide.
Yeah, next slide.
Next slide.
Ça ne bouge pas chez moi. OK, next slide. Non, revenez. Oui, passez, passez.
Next slide, please. Next.
Next. Oh. Non, passez, s'il vous plaît.
Next.
OK, voilà l'aperçu de notre dashboard.
Next slide, please.
OK, next slide. Et là, nous disons que ce sont les résultats des 3 DPS que nous allons vous présenter. Et il s'agit du Sud Kivu, du Nord Kivu et de Kinshasa. Et à ce jour, nous avons 100 établissements de soins qui sont évalués et dont le score moyen de PCI est de 47,6%. Et donc, le score euh, n'est pas fameux, n'est pas bon, et il y a beaucoup d'actions qui doivent se tenir. Et vous voyez qu'il y a beaucoup de faiblesses qui ont été relevées. On voit les indicateurs en rapport avec la formation. Il n'y a que 15% des prestataires de soins qui sont formés en PCI après cette évaluation. C'est un score qui est vraiment faible, dangereusement faible. Et le deuxième indicateur, c'est par rapport à la disponibilité des équipements de protection individuelle dans les établissements de soins. Et là, on est à 29%. Et donc, c'est encore trop faible par rapport à ce qui est attendu. Par rapport aux isolements, c'est-à-dire le système de triage et isolement, et là, nous sommes à 29%. Donc, voilà encore une fois un indicateur qui est faible. Par rapport à la mise en place des triages, permettez, c'est trop petit. Voilà, par rapport à la surveillance de la gestion hospitalière, il y a 43% des structures qui font cette surveillance. Par rapport à la disposition et à la gestion des cadavres liés au monkeypox, là c'est encore très faible, c'est à 17,5%. Par rapport à la prise en charge des prestataires de première ligne, c'est 18%. Et par rapport à la décontamination des équipements médicaux, c'est à 44,4%. Et donc, en général, vous allez voir que les indicateurs PCI sur les 100 établissements de soins prélevés ou réalisés sur les 100 établissements de soins est trop faible. Et donc, ça nécessite un accompagnement et beaucoup d'efforts pour essayer de relever le niveau de PCI. Dia. Slide. Et voilà, donc ici nous relevons les problèmes, quelques recommandations que nous avons formulées et quelles sont les activités qui sont en cours pour combler ces gaps. Voilà, nous y allons avec le premier problème ou l'indicateur en rapport avec le dépistage et isolement. Vous allez voir, nous sommes à 33,3 et 29%. Et la recommandation de renforcer les capacités des établissements de soins dans le dépistage et la mise en place des systèmes de triage et isolement. Et aussi de rendre disponibles les outils de triage dans les différentes structures de triage. Et comme activité en cours, nous allons, pour relever le niveau, pour recombler ce gap, nous avons élaboré un plan de mise en place des systèmes de triage et isolement dans les établissements de soins du Nord Kivu, du Sud Kivu et de Kinshasa. Et ce plan est en cours de mise en œuvre. Et comme deuxième recommandation que nous avons prise, c'est en rapport avec la distribution des outils. Donc, il faudra mettre à disposition des établissements de soins les procédures de triage et même les intrants pour que ce système de triage soit fonctionnel. Par rapport au deuxième problème, en rapport avec le leadership et l'hygiène des mains, là, nous avons proposé de renforcer les capacités des comités d'hygiène en PCI achat et de rendre disponibles aussi les équipements de protection individuelle C'est vraiment un défi pour cette report. Et comme activité qui est en cours, c'est la mise en place d'un plan de redynamisation qui est en cours et la dotation de kits. Dernièrement, il y a eu une dotation avec OMS, UGPDCS, la Banque mondiale. Et actuellement, nous constatons encore que les structures ne sont pas approvisionnées en EPI. Et donc, ce sont les activités qui sont en cours pour relever ce défi. Slide.
Doctor, if you can wrap up, please, as we're running out of time. Thank you.
Thank you, Gerald.
All right, so I guess we can close this. Thank you very much, and we will be sharing the presentation as well. Today's webinar will also be accessible through online through YouTube and through our website. So Vicky, I'll give over to you for a very quick wrap up, perhaps. And thank you for the presenter before we really close. Vicky?
Thank you so much, Lester, and thank you to everyone who joined today. We appreciate your time and your attendance. We hope you found this helpful. And I would also wanted to say a special thank you to our colleagues from Africa CDC and from DRC who joined us today to share their information. We hope, again, that everyone online found this helpful. Please visit our website and definitely reach out if you have any additional questions. I think there's some methods through EPIWIN to do that.
Yeah.
And of course, you can always contact your WHO country office and focal points and get to us through that channel. So over to you, Lester. Thank you.
Thank you, Vicky. Thank you very much, everyone. And we really apologize for a lot of technical difficulties today, but thank you to you all for coming and for your questions. The recording of this webinar will be available at the EPIWIN website. An EPIWIN digest, a slide set with key messages on this topic, will be published shortly. If you want to keep updated on future EPIWIN webinars, recordings, and presentations, and the EPIWIN digests, please subscribe to our mailing list. Both links will be appearing in the chat. We hope you will join us for our next webinar. It will be on Thursday, October 17, on STAR Experience in Managing Health Emergencies and Disasters, including climate crisis in countries. Details will be posted on the website and sent to the mailing list. Thank you very much. Thank you.
We can leave now, Lester.
Oh, yes, yes.
Okay,
very
thank you. Bye. Thanks for your
much.
help.
Thank
Bye-bye.
you so much. Bye-bye. Thank you, panelists and speakers. Well,
Bye. Thanks.
thank you.
Bye, Lester.